Imagine an ordinary morning. An older adult is standing in the kitchen, doing something routine, when suddenly the mug slips from their hand. One arm feels strangely heavy. When they try to speak, the words don't come out right. One side of the face no longer responds the way it should. A stroke has begun. What's remarkable isn't just what's happening, but what happens next. Before emergency help even reaches the home, this person does something unexpectedly simple. No medication, no complex procedure, no medical equipment, just a deliberate change in body position paired with controlled breathing. Later, an emergency physician explains that those few calm actions likely spared the brain from lasting damage. Here's what most people don't realize. The human body has built-in emergency mechanisms that can help preserve blood flow to the brain in the critical moments before medical care arrives. And in the next few minutes, you're going to learn exactly how to activate them. Consider this sobering reality. In the United States alone, a stroke occurs roughly every 40 seconds. Yet what determines the outcome isn't only what happens in the hospital. The first few minutes before professionals arrive often decide whether someone recovers fully or lives with permanent disability. Those moments carry extraordinary weight. Today, you're going to learn how to recognize the earliest warning signals the body sends just before a stroke takes hold. More importantly, you'll learn a positioning and breathing method supported by modern neurological research that can help maintain circulation to the brain during that narrow window. This isn't speculation. It's grounded in current medical understanding and can be learned by anyone right now at home. By the end, you won't just know what to do. You'll understand why it works. To appreciate the power of this technique, we first need to understand what's happening inside the brain when a stroke begins. Many people imagine a stroke as an instant shutdown. 1 second you're fine, the next everything is lost. In reality, it often unfolds more subtly. Picture the brain as a vast, illuminated city. Every movement, memory, and thought depends on a steady flow of oxygen-rich blood traveling through countless pathways. When one of those pathways becomes blocked, even briefly, part of that city dims. Sometimes the lights flicker back on. This is what clinicians call a transient ischemic event, often dismissed as a minor episode. But there's nothing minor about it. It's the brain's emergency alarm warning that a much larger event may be imminent. Too often, these early signals are ignored. A hand feels weak for a moment. Balance feels off. Words don't come easily, then everything seems to return to normal. Many people assume it's fatigue, stress, or standing up too quickly. But these are not random glitches. They are distress calls. A clot may have formed in the heart, the neck, or within narrowed arteries elsewhere in the body. When it interrupts oxygen delivery to brain tissue, damage begins within minutes. Yet in the very early stages, before the blockage becomes complete, the body can still compensate. That brief window is where targeted positioning and breathing can make a meaningful difference. So what warning signs should never be ignored? Sudden weakness or numbness affecting one side of the body, difficulty speaking or understanding simple phrases, drooping on one side of the face, sudden changes in vision, loss of balance without an obvious cause, or an intense headache that appears abruptly and feels unlike anything before. Here's the dangerous part. These symptoms can last only a minute and then disappear. When they do, many people feel relieved and assume the danger has passed. In reality, the opposite is true. When symptoms fade, the countdown has begun. Why do so many older adults hesitate to act? For many, it's a lifetime habit of endurance. They were taught not to complain, not to overreact, not to seek help unless absolutely necessary. So when something strange happens, they minimize it. They wait. That instinct, admirable in other contexts, can be devastating during a stroke. Minutes matter. Waiting can mean the difference between independence and lifelong impairment. Distinguishing normal aging from true danger is critical. Feeling lightheaded after standing quickly is usually benign. Feeling dizzy while seated or resting is not. Forgetting an item temporarily is common. Being suddenly unable to form clear sentences is not. The line can be subtle, but understanding it can save a life. Now let's talk about the method itself. This is the technique that has helped preserve brain function in real emergencies and is supported by recent neurological research. It relies on two simple principles: gravity and controlled respiration. When a stroke is suspected, the priority is to support circulation to the brain as efficiently as possible. The fastest way to do that without equipment is to change body position. As soon as warning signs appear, the individual should sit or lie down immediately to prevent a fall. If possible, lying flat on the back is ideal. Next, the legs should be elevated roughly a foot above heart level using pillows, cushions, or a stable surface. This shift allows blood pooled in the lower extremities to return toward the heart and upward to the brain. Gravity becomes an ally instead of an obstacle. But position alone isn't enough. Breathing is the second critical component. The goal is slow, deliberate, rhythmic breathing. Inhale gently through the nose for about 4 seconds, hold briefly for 2 seconds, then exhale slowly through the mouth for 6 seconds. This pattern isn't arbitrary. It increases oxygen availability in the bloodstream while calming the nervous system and stabilizing blood pressure. Panic causes blood vessels to constrict and breathing to become shallow. Controlled breathing does the opposite. It preserves oxygen delivery when the brain needs it most. Clinical observations and studies published in recent years show that individuals who used this combination of leg elevation and controlled breathing during early ischemic events experienced better outcomes than those who did not. This technique does not replace emergency care. It buys time. And in stroke treatment, time is everything. In the moment, fear and confusion are natural, but having a clear action plan restores a sense of control. Calm breathing helps maintain clarity, making it easier to call for help, remember when symptoms began, and remain still until assistance arrives. To be clear, the goal is not to test strength, walk it off, or see if symptoms pass. The goal is to get horizontal, elevate the legs, regulate breathing, and allow the body's own mechanisms to support the brain until professionals take over. There is also reason for hope beyond the emergency itself. The brain has an extraordinary capacity for adaptation. This ability, known as neuroplasticity, allows undamaged areas of the brain to take over functions lost during a stroke. With proper support, speech, coordination, and memory can improve even months later. Early rehabilitation matters, but so does what happens afterward. Gentle movement, guided breathing, and consistent daily activity stimulate new neural pathways. Research from neurological centers around the world has shown that even simple seated exercises performed regularly can significantly improve balance and cognitive recovery in older adults. Nutrition also plays a major role in both recovery and prevention. Diets rich in omega-3 fats, antioxidants, and natural compounds that support blood vessel flexibility are associated with lower rates of recurrent stroke. Patterns such as Mediterranean-style eating have been linked to markedly reduced risk over time. Prevention ultimately comes down to circulation. Healthy blood flow supports brain health long before symptoms ever appear. Simple daily habits make a difference. Gentle movement shortly after waking, deep breathing, hydration, and light stretching all help prevent morning blood pressure spikes and improve oxygen delivery. Stress management is equally important. Chronic stress constricts blood vessels, while relaxation, social connection, laughter, and music encourage vascular flexibility. These effects are biochemical, not just emotional. This brings us back to the opening scenario. The outcome wasn't determined by luck. It was shaped by preparation. Knowing what to do transformed fear into focused action. Calm, informed responses preserved brain tissue. This isn't about living in fear of stroke. It's about living with readiness. Readiness empowers you and reassures those around you. Aging doesn't mean helplessness. It means awareness and adaptation. Remember this simple principle: when circulation is threatened, stay calm, lie down, elevate the legs, breathe slowly and deliberately. Let gravity and oxygen work for you. Health isn't about avoiding every crisis. It's about knowing how to respond when one appears. Practice this technique mentally. Make it familiar. Because in an emergency, instinct matters. Stay calm, stay informed. And remember, your body often gives you a chance to protect itself, if you know how to respond.